Have you ever found yourself unable to sit still, a persistent urge to move, to pace, to tap your foot? Perhaps your mind is racing, jumping from one thought to the next, making it impossible to truly settle. It's that feeling of being perpetually on edge, as if waiting for something to happen, even when nothing concrete is in sight. If this sounds familiar, you're not alone. This is what we call anxiety restlessness, and it's a far more common experience than many realize. It's a pervasive feeling of unease and agitation, both mentally and physically, that can truly disrupt our sense of peace. Today, we're going to explore this intriguing and often challenging symptom. We'll delve into why anxiety restlessness happens, peeling back the layers of our biology, psychology, and even our modern lifestyles. More importantly, we'll discuss practical, evidence-informed strategies that can genuinely help manage and alleviate these feelings. My aim is to offer clarity, empathy, and actionable steps so you can better understand yourself and find pathways to a calmer existence. Let's start by painting a clearer picture of what anxiety restlessness actually looks like, because it's not just one thing, it's a spectrum of experiences. On the mental side, it often manifests as a torrent of racing thoughts, making concentration feel like an impossible task. You might find yourself easily irritable, unable to focus, or just feeling a generalized sense of being on alert. It's like your internal alarm system is stuck in the on position. Physically, the signs can be equally varied and undeniable. Maybe you're constantly fidgeting, unable to keep your hands still, or perhaps you pace back and forth, find it impossible to sit through a meeting, or your legs bounce relentlessly under the table. There can be noticeable muscle tension, a persistent knot in your shoulders or jaw. Beyond these movements, your body might also signal distress through heart palpitations, a feeling of shortness of breath, sudden sweating, or even a subtle trembling. These are all the body's ways of expressing that inner unease. So, why does this happen? At its core, anxiety restlessness is a fundamental physiological response. It's your nervous system perceiving danger or uncertainty, even when there's no immediate, obvious threat. Think of it like your body's ancient fight or flight mechanism kicking into overdrive, but without a clear enemy to fight or flee from. This state is driven by a complex interplay of physiological, psychological, and environmental factors. From a physiological standpoint, when we perceive stress, our body releases stress hormones like adrenaline and cortisol. These are designed to prepare us for action, sharpening our senses and boosting our energy. But when this response is prolonged or triggered too easily, it leaves us in a heightened state of alert, leading directly to restlessness. There are also subtle chemical imbalances in the brain at play. Neurotransmitters like norepinephrine, which helps with alertness, serotonin, which regulates mood, dopamine, associated with reward and motivation, and GABA, our brain's natural calming agent, all contribute to this delicate balance. When these are out of sync, it can affect our mood and energy levels. And deep within our brain, there's a small almond-shaped structure called the amygdala, often called our brain's fear center. In states of anxiety, the amygdala can become overactive, constantly sounding the alarm, making us feel more fearful and, yes, more restless.
While occasional restlessness is a normal reaction to stress, we all feel it before a big presentation or a challenging event, persistent, debilitating symptoms can point to deeper underlying conditions. These might include generalized anxiety disorder, where worry is a constant companion, depression, which can manifest with agitation, or even conditions like attention deficit hyperactivity disorder, where restlessness is a core symptom. Less commonly, physical conditions like hyperthyroidism, which speeds up metabolism, or restless leg syndrome, a neurological disorder, can also induce similar sensations. Even traumatic experiences, severe or long-lasting stress, and a genetic predisposition can contribute to a nervous system that's more prone to this kind of agitation. Our modern lifestyles also play a significant role. Consider the widespread use of certain substances. For example, pre-workout supplements, popular especially among younger people, often contain high levels of stimulants. While intended to boost energy for exercise, these can profoundly interfere with sleep and recovery, two pillars of mental well-being, potentially worsening anxiety and restlessness. Similarly, even small amounts of substance use, like tobacco, are linked to increased health risks and can exacerbate anxiety. And it's well known that substance use or withdrawal can be a direct trigger for intense restlessness and agitation. We also see instances where certain medications, like antipsychotics, can have side effects such as akathisia, a severe form of inner restlessness and inability to stay still. The impact of unmanaged anxiety restlessness shouldn't be underestimated. It's not just an annoying feeling, it can severely disrupt every aspect of daily life. Imagine trying to focus at work or school when your mind is a whirlwind and your body constantly demands to move. It strains family relationships, makes social interactions challenging, and can lead to considerable personal distress. It isolates us, making us feel like we're constantly fighting an internal battle no one else understands. But there is good news. Anxiety restlessness is highly manageable. The path to relief typically involves a multimodal approach, meaning we often combine different strategies for the best results. This often includes medication, psychotherapy, and crucial self-care strategies. Let's talk about psychotherapy first. Cognitive behavioral therapy, or CBT, is a cornerstone here. It helps you identify those racing, anxious thought patterns, and then challenges them, teaching you how to reframe them more realistically. It also helps you modify behaviors linked to anxiety. Exposure therapy, often used for specific fears, gradually exposes you to anxiety-provoking situations in a safe environment, helping you build tolerance and reduce your fear response. Acceptance and commitment therapy, or ACT, is another powerful approach that helps you accept difficult thoughts and feelings, rather than fighting them, and commit to actions aligned with your values. When it comes to medication, options include antidepressants like SSRIs and SNRIs, which help balance neurotransmitters, or sometimes tricyclic antidepressants. Benzodiazepines might be prescribed for acute anxiety, but are used cautiously due to their potential for dependence. Beta blockers can also be helpful in managing the physical symptoms like heart palpitations and trembling, without directly affecting your mood. The choice of medication is always a highly individualized decision made with a healthcare professional. But crucially, self-care strategies are not just supplementary, they are foundational. Simple stress management techniques like deep breathing exercises, progressive muscle relaxation, and mindfulness meditation can be incredibly effective. Mindfulness in particular teaches you to observe your thoughts and feelings without judgment, creating a sense of distance from the restlessness.
Regular physical exercise is a powerful antidote, helping to release pent-up energy and reduce stress hormones. A balanced, nutritious diet supports overall brain health. Prioritizing adequate, quality sleep is non-negotiable, as sleep deprivation significantly exacerbates anxiety. And it almost goes without saying, but avoiding stimulants like excessive caffeine and illicit drugs is paramount. Actively engaging in enjoyable hobbies and activities, and finding connection in support groups can also provide immense relief and a sense of community. The understanding and treatment of anxiety restlessness involves a wide range of professionals, from your general practitioner to psychiatrists, psychologists, and specialized therapists. Institutions like the National Institute of Mental Health and the World Health Organization conduct vital research and establish diagnostic criteria, constantly refining our understanding. This field is always evolving, with ongoing discussions around diagnostic boundaries, distinguishing normal stress from a disorder, and optimizing treatment strategies. We're continually exploring the balance between medication and therapy, and refining how we assess treatment success, focusing not just on symptom reduction, but on improving overall quality of life. The role of complementary therapies, like yoga and nutrition, is also being increasingly recognized as crucial adjuncts to conventional treatments. Ultimately, the future of addressing anxiety restlessness lies in a more precise, personalized approach. As research continues to unravel the intricate neurobiological underpinnings, we anticipate even more targeted and effective treatments. But even now, with our current knowledge, understanding that restlessness is a signal, not a failing, is the first step. It's a message from your body and mind asking for attention, for support, and for strategies to find calm. If you experience anxiety restlessness, remember, you are not alone. It's a complex symptom with understandable causes, and there are many effective ways to manage it. Seek out healthcare providers who can offer guidance, explore different therapeutic approaches, and commit to those self-care strategies that resonate with you. With patience and consistent effort, you can move from a state of constant agitation to one of greater peace and control. Taking that first step towards understanding and action is a powerful act of self-care.